Welcome to Yesterday, Today, Tomorrow. My name is Grace Rivera-Oven, and I'm your host for tonight. After a ruling by the U.S. Supreme Court on January 27 of this year, the Department of Homeland Security can now implement their new rule relating to public charge. What does it mean, and who does it affect? News of the coronavirus has prompted concern about risks of transmission in the United States. Although influenza viruses and coronaviruses have similar symptoms, the risks of catching the flu in the U.S. remains high greater. We'll discuss what you need to know. Our guests tonight are Council Member Gabe Albornoz, Dr. Raymond Crowel, Director of the Department of Health and Human Services, Dr. Carlos Picone, a local doctor and pulmonologist, and Leslie Graham, President and CEO of the Primary Care Coalition. So, Gabe, last week, actually, you and Councilmember Navarro, along with some of your colleagues, had a press conference on public charge. And it got very sentimental for those of us who were there. Tell us a little bit about why did you guys decide that this was a time to have such a conference?
Well, there's been an unprecedented assault in my lifetime on immigration and on immigrants who are being scapegoated right now for so many challenges facing our community. And we have sensed in Montgomery County, we have felt the raw emotion, and we have seen just the negative impact on our local communities that this administration is having. And we felt that these policies are immoral, and this, for me, was just the final straw. And so the County Council issued a unanimous resolution denouncing the most recent immoral policy of this administration, which is aimed to further divide us, which is aimed to further spread fear. And that ultimately, unfortunately, is the intent. And it is working. We are starting to see that fewer and fewer county residents are accessing services that we know that they need and that we know ensure public health for the entire community, not just those citizens and residents who are accessing those programs. And so we felt it was time to publicly take a stand against some of these issues, and so we issued the resolution.
Leslie, for those who are watching at home, tell us just a little bit, what is public charge?
So public charge is an executive order. Public charge has existed for a long time, and it is the federal government looks when people are moving through their immigration status. It looks at whether or not somebody is going to be a charge on the public, whether they're going to use public welfare services, if you will. But previously it was defined in a very narrow way as to what would count as a public charge. And now the federal government has somewhat expanded those. In reality, the items that it was expanded to are things like SNAP, food stamps, or Section 8 housing. And those are things that are largely only those who have permanent residency are eligible for anyway, permanent residency and some other visa statuses. But the way that this was released with a leak over a year ago of a much more severe form of what public charge would be has really caused fear in the community and a lot of confusion over who might have their pending immigration status affected by public charge. It's caused a lot of confusion.
And I know our Department of Health and Human Services, Raymond, you were at the press conference and spoke very eloquently as well. So tell us, for those who might fear, because we have seen and we have heard of individuals disqualifying themselves from programs such as Care for Kids. So could you tell us a little bit about what your message was?
Sure, my message was that the Department of Health and Human Services is open for all Montgomery County residents all the time, without regard of their immigration status or their ethnicity or their race. We're here to serve. One of my concerns is that the fear goes in two directions. One is its fear of public charge and what public charge means or may not mean, and there's a lot of misinformation out there. But also, HHS is government. And in these times when government is doing things like public charge, it makes people feel that government can't be trusted. Health and Human Services is in the business of trying to find ways to give people resources or put resources in people's paths that will help them restore their health or keep them healthy. We're not in the business of sharing information or divulging information. Our goal is to try to help people and to protect their privacy. And so that's our mission. And so the fear is that people will either disenroll from services and benefits that they already have, or they will not come and enroll for services that could save their lives.
Correct. So. And one of those clinics or so on is Mobile Med that Dr. Picone Carlos actually serves on the board, but you are very active. You have been active since I've known you, I believe, for so many years, and you see the most needy who come to get services from Mobile Med.
Right. As you know, there's so many more people who are now covered by different health insurances since the Accountable Care Act. So many people that have been transferred from the indigent type care to, now that have insurance, are no longer served, some of them by Mobile Med, just because the healthcare system has sort of stepped in and been able to provide the healthcare they need. But certainly there is a need, and so we're fortunate that Montgomery County supports Mobile Med, and most people who need healthcare in Montgomery County, can still receive it.
Correct. Let's talk a little bit about some of the myths that, like you said, it has created an environment of fear for people to actually access some of these programs. The Primary Care Coalition's kudos to you, Leslie, under your leadership, put out a very well thought out link with a letter explaining what public charge is, but also some of those frequently asked questions. Would you, I know we're going to put up the website and so on, but what are some of those questions that you think are the most common that folks might have right now?
Well, a lot of people ask questions like, if I'm applying for Medicaid or CHIP for my child, and I write something on the application and I'm asked for my Social Security or need to divulge my immigration status, does it affect me? The answer is no, it does not. You don't need to report that. You're applying only for your child. You are not required to put anything. You need to put your name, but you don't need to divulge your immigration status, and it's not relevant to your child's application. And if your child gets Medicaid or children's health insurance, that doesn't affect your immigration status. So the public charge is only about you and the services that you partake
personally
of.
Receive.
Yeah, and again, I'll state that most of the things that are covered now under public charge or count as public charge, you actually would only be eligible for if you've already passed into having your permanent residency or green card. And so it really wouldn't affect you.
And I know, Raymond, that even some folks who there's a way actually that if you don't have an immigration status or so on, you wouldn't even be allowed without a Social Security number or anything to be able to apply for any of these programs.
Well, the services range that we're talking about are federally funded services or federal government services, and there's a whole series of information that you have to share, and some of that is Social Security cards, immigration status, those sorts of things. So you have to have those things to be eligible for them. What Health and Human Services offers, and it's important for folks to know that we offer a range of services, not just the federal services, but there are services that are brought to us by the state and services that the county pays for, and they are not part of the public charge. So the residents can come and get those services, but they have to be willing to come and talk about what their needs are so that we can help them to figure out what's available for them.
Right.
I think that's two of the programs that Raymond is referencing. Montgomery Cares, which is a program for adults in Montgomery County who don't have insurance, and Care for Kids, which is a program for children in Montgomery County who don't have insurance and aren't eligible to get insurance. We do see that Primary Care Coalition administers both of those programs in partnership with the Department of Health and Human Services and Dr. Crowell's group. And we are seeing people pulling back and not wanting to apply for these programs, even though these programs are entirely locally funded.
Right.
They receive no federal funds whatsoever, and therefore are not subject to impacting public charge at all.
It is so important to educate the community, I believe, because we are largely in Montgomery County, majority community, and we have a large immigrant and even refugee population. So, council member, the message that you would like to,
Right.
to give to
Well,
to the community.
Montgomery County has a long history of being welcoming to our immigrant community. It's why my parents and their parents chose Montgomery County to bring our families. And I got emotional during that press conference when thinking about
Yes.
their journey and how they arrived here. And that's what's so frustrating about all of this is that our immigrant population is contributing to our economy. They are helping to make sure that they're strengthening our safety net by taking jobs that are so critically important to our health and human service infrastructure. The fastest growing demographic we have in Montgomery County is our aging population. There are not enough workers right now to address their needs. Our immigrant population, in many ways, that's just one example, is stepping in to address those needs. So we have to get the message out to our community that we have the infrastructure here to weather this terrible storm that we're in on a national level. But it's going to take partnerships through the Primary Care Coalition, Mobile Med, the Department of Health and Human Services, our faith-based organizations, everybody that has some element of trust within our community. It has to be an all-hands-on-deck situation. And that was another purpose for this press conference, is not just to call out this insanity, but to use it as a vehicle to get the correct information out to our community and to let them know we're so happy they're here and we're here to support them.
Absolutely. Well, let's talk a little bit about this pandemonium that it has it has started around the world with this coronavirus. We have the right person at the table to tell us a little bit what is coronavirus. But most importantly, Carlos, the message of actually that influenza is killing more children. I think this has been one of the highest incident deaths of children because of influenza.
Well, it is true that certainly, we have an annual influenza epidemic, and we know that it will be here. It has been here in our community since October. In fact, this is one of the influenza seasons that struck relatively early, and it has been quite severe, even though the vaccine has been quite protective in that regard. But yes, nationwide, there have been over 15 million cases of influenza confirmed.
Wow.
There are many more cases that, of course, are subclinical and that are not reported. So the anticipated number is over 15 million. And there's a total of over 10,000 people that have died in this season alone. So when you compare 10,000. So when you think about the number of people who have been infected, of course everyone talks about coronavirus and how deadly coronavirus can be. First of all, we don't really know the case fatality rate. That is, of all the people who become infected, how many of them really go on to develop severe disease? Because we truly don't have a proper denominator. We just the disease is so new. And we have to realize that viral infections, that our existence would be impossible without viruses. So viruses and are agents, in a way, agents of life, we like it or not.
Only a doctor could like that.
Well,
That's right.
But it's truly, when you look at it in that manner, I mean, it's just it would be impossible to understand the evolution of species without the transfer of genes that has taken place over the eons thanks to viruses. We would not be here certainly without those particular agents, those transmission of different portions of genome that has allowed over the millions of years for the appearance of new species. And of course, this is something that is happening all the time. There are new viruses that develop all the time. This one happens to be, one that is become more significant. You of course know about the Middle Eastern coronavirus that struck a few years back in 2012. There was another one more severe, the SARS virus, in 2003. In fact, in Canada was a significant problem. And now we have this new coronavirus. But I think we need to take a deep breath, just relax. We should be fine. I mean, it's amazing that to me that the virus was isolated, and the genome was sequenced in the course of 6 weeks.
Wow.
And it is likely that in another 6 weeks, we probably will have the first, probably not necessarily the first clinical trials, but within 3 months, we'll probably have clinical trials and vaccine development. So
Yeah,
when
and
you
I
take a
think
deep
that there's
breath,
a local, actually, there's a local biotech company in Gaithersburg that has come up with
well, there's
a-
an international consortium in that
Right.
regard that is working on it. Within probably
Right.
before April, we'll have a diagnostic kit. Right now, when there is a case that is suspected, the samples have to be sent to the CDC, and of course, there's a process to investigate. But what I would say is calm. You likely, if you're coughing and sneezing and have a fever, you likely do not have coronavirus. You probably just have the flu.
Is it too late to get the flu shot?
That's a good question. No, historically, the peak of the influenza season is actually the first week of February. February 6th
Wow.
is normally the peak of the influenza
Okay,
season. So
Wow.
if you have not received your flu shot, you should go get your flu shot.
Oh,
It's a good investment.
okay. Is it okay? And I'm sure a health department. I don't think we have. There's been speculation that we had a coronavirus incident in the county, or that somebody was actually under quarantine. I mean, you hear all these things, but
Well, I think there has been one, maybe two cases that were pending but not confirmed, and I think in the region we at this point don't have any cases that have been confirmed for coronavirus. It's one of these things where our belief is that if you take the precautions you would take to avoid the flu and avoid picking up the flu from someone else, then
Same
you're
thing.
then you're safe.
Right.
And the other thing we were asking, the last time I looked, we had, I think, as of last Friday, I think 11 cases nationwide that were confirmed coronavirus, and those folks have been socially isolated and self-socially isolated. So.
rapidly, one of the things we were talking off camera was about the vaping situation. You as a pulmonologist, you think we have a crisis of vaping, especially among our young people?
Yes, unfortunately, vaping has become the gateway towards, addiction or exposure to nicotine. As you recall, about a decade ago, when really vaping, gathered some steam, it really was commercialized as a way one of the means of tobacco cessation. But it's really for the adolescents has become a way of, unfortunately, getting into nicotine and one more, addictive exposures. And we have known for a long time that it can cause disease. Now we know that it can cause serious disease and fatal disease. So for the audience out there,
Especially
if
with
nature
young,
did not
the
intend it,
teenagers.
if nature did not intend it, don't do it.
Yes.
It's very simple.
Yeah.
And I know there's legislation pending.
There is. It's a huge issue, and just as it is a huge issue across the entire country, we know nationally 1 in 4 students, teenagers, have tried it at least once. And it because of its high concentration and form, you can get addicted to it so quickly. And because of the nefarious marketing by Juul and other industries, there's this perception it's somehow more safe than cigarettes. But in these pods, within some of these USB ports and these, the concentration is actually 20 cigarettes per pod.
Wow.
And students don't regulate the nicotine that they're consuming. And there has been this misperception also that vaping somehow helps people who are cigarette users get off of cigarettes. That may be true, but it's only slightly less bad than the cigarette use. And so we have 3 bills in the county right now. We're trying to lead the way to restrict access to our teens as much as humanly possible. More alarmingly is the amount of middle school students that are beginning to access this as well. And so one of the bills basically restricts access to the purchase of these products from any retailer within a half mile of a middle school or a high school. And the second bill restricts all of the flavored products within a half mile of all schools and libraries as well, which effectively is like a ban. So these are just some of the steps that the county's taking, and I really want to thank Dr. Crowel and the Department of Health and Human Services for bringing this issue to our attention in the first place. I first learned about this issue, and I have 4 kids, and I was caught very flat-footed on this by a meeting convened by Dr. Gales last year with different stakeholders. And it was then we realized we needed to take action as quickly as possible.
What does it do to your lungs? You're a pulmonologist. So
Yes.
when you're addicted to the point that Councilmember Albornoz is saying, what does it do physically to your lungs?
Right. So when you are vaping, you're not smoking. So the difference between smoking and vaping is, in smoking there is combustion, so there is burning, and in vaping there is not. There is just a liquid that is being heated, and so there is a vapor that is released, and that vapor is inhaled, and of course we have our pulmonary membrane, the respiratory membrane, is as big as a tennis court. If you were able to fold out all of the alveoli of your lungs, imagine that you have that surface, that pulmonary capillary surface, you have a tennis field for absorption. So within seconds, when you inhale, within 5 to 6 seconds, all of that is into the bloodstream, and then with the next heartbeat into your brain. So that's why when
You need him to come and testify.
Yes.
Really?
and that is why it is just so addictive. And nicotine, we know nicotine impacts the dopaminergic receptors in the pleasure centers of the brain. And you can imagine that when you get that massive bolus dose, those peaks and valleys, so the brain then becomes, in adolescent brain becomes easily addicted. And then, those are the, kids that are frequently, that want to go back and get that stimulation and that pleasure, that release of pleasure. And so that's why, it truly, when they first proposed, this as a means of, tobacco cessation, the medical community sounded the alarm bells back then, and we just felt that it was not a good idea. Then there were cases reported of a condition called bronchiolitis obliterans organized pneumonia that is, very much what has happened now with the, vaping epidemic. That was reported over a decade ago. It's just that now, it reached epidemic proportions in Colorado, in Wisconsin, in Michigan, and so when it really, this became part of the national discourse, then now, we're taking more action. But it's certainly something that has been simmering in the background for quite some time.
Well, I thank you both for for your explanation. I'm going to make sure my 18-year-old watches this show, because I think kids think they're invincible and that nothing touches them at a young age, and how addicted this can be. But thank you to our council members for introducing all these bills and also supporting what is in Annapolis. Just as a cautionary note to parents, you can actually be part of this conversation. You should go and testify to ensure that we're supporting bills like the ones you were talking about, Gabe, and that people can actually, if they don't have the time, they can even chime in, and I hope you find the time to actually go and testify, Carlos, because that was very educational.
Sure.
And I think this is a village, and we need everybody in the village to do so. But I just wanted to say thank you to all of you for joining me, here tonight. You at home, please check out Yesterday, Today, Tomorrow on YouTube, Facebook, and Instagram. We would like to hear from you. And again, thank you to Councilmember Albornoz, Dr. Raymond Crowel, Leslie for your great work with Primary Care Coalition, and Dr. Picone. And my name is Grace Rivera-Oven. We hope to see you next week at the same time, and we wish you all a wonderful week, and be nice and good to each other.